Hello, anatomy friends. This is Dr. Alsop, and in this video, we will be discussing the very basics of cranial nerves. So now, this is the time to start really actually learning all 12 of the cranial nerves and the basics of what they do. So we will list them, so both the Roman numeral as well as the name, and then we'll list the basic characteristics of each. So are they motor? Are they sensory? Are they both? And their general target organs. Recall that although we often very much describe the cranial nerves in discussions of the brain, since they exit the brain and innervate non-CNS structures, they are considered components of the peripheral nervous system, similar to spinal nerves. One big difference between cranial nerves and spinal nerves are where spinal nerves are composed of both sensory and motor fibers. Some of the cranial nerves are composed of only sensory fibers or only motor fibers, while some are both, so they'll have both sensory and motor. Cranial nerves are closely associated with what are called cranial nerve nuclei that are located within the brain. So these are groups of neurons in the brain where the efferent fibers originate and the afferent fibers will terminate. So let's get into some of these basics. As you might have guessed, we're going to start with cranial nerve 1 and make our way to cranial nerve 12. So cranial nerve 1 is the olfactory nerve. This nerve is entirely sensory. In fact, it is what we call special sensory. So what does that mean? Why is it so special? Well, all special means is that this nerve is composed of axons or fibers transmitting unique sensations. Think of those five senses you likely grew up learning, plus some bonuses. The olfactory nerve is associated with the sense of smell, sensation of odors that result from the detection of odorous substances that are aerialized in the environment. So the origin and journey of the olfactory nerves and the associated structures, such as the olfactory bulb and the olfactory tract, is that these olfactory tracts are the ones that are actually typically the most easy to observe grossly. But this nerve is pretty complex. And so for our purposes now, we want you to just understand the olfactory nerve is cranial nerve 1 and is composed of special sensory fibers associated with the sense of smell. So I told you, very basics here. Also entirely sensory and special sensory to boot is the optic nerve or cranial nerve 2, which functions in vision. The optic nerve begins where the axons of the retinal ganglion are going to pierce the sclera, so the whites of the eye, this kind of outer layer. And from there, we're going to consider that the optic nerve, it will enter into the middle cranial fossa, where there's the formation of the optic chiasm. And the fibers from the medial half of each retina will decussate or cross in that optic chiasm and join the uncrossed fibers from the other side. So this partial crossing that will happen is very essential in terms of binocular vision. Now, we've had two entirely sensory nerves, so let's move on to an entirely motor nerve, which we have here is cranial nerve 3 or the oculomotor nerve. The oculomotor nerve sends somatic motor fibers to all extraocular eye muscles except for the superior oblique and the lateral rectus. Those are going to be innervated by different cranial nerves. And up until now, the only cranial nerve that we knew had parasympathetic or visceral motor fibers was the vagus nerve. Well, that's all about to change because the oculomotor nerve also has preganglionic parasympathetic fibers that will synapse in the ciliary ganglion for innervating the ciliary muscle or muscles, because there's one in each eye, and the sphincter papillae muscle. So the ciliary muscle plays a role in terms of accommodation or keeping things in focus. And the sphincter papillae does exactly what it sounds like it would do. It is going to constrict the pupil. Next, we have the trochlear nerve or cranial nerve 4, which is entirely somatic motor. This will innervate the superior oblique muscle, which is an extraocular muscle. This nerve is named after the trochlea or pulley that is associated with the superior oblique. So this will help change the direction of the muscle and the direction of the pull that will occur with contraction. All right, our first nerve with both sensory and motor fibers. This also happens to be the largest cranial nerve, and this is trigeminal or cranial nerve 5. Two of the three divisions are entirely sensory. So V1, also known as the ophthalmic nerve or division, and V2, aka the maxillary nerve. V3, or the mandibular nerve, has both afferent and efferent fibers. And those motor fibers will innervate the muscles of mastication or chewing with a few neighboring muscles. This is a very important sensory nerve as well. It's going to be the main sensory nerve of the skin of the face. And there's a generalized dermatome map showing the coverage here in the right. It will provide innervation to the skin in that region. It will also innervate the teeth, the gingiva, and paranasal sinuses to share a few other regions as well. The abducens nerve or cranial nerve 6 is relatively simple compared to the trigeminal nerve. This nerve is entirely somatic motor, and it will only innervate the lateral rectus muscle, another one of those extraocular muscles. And the lateral rectus muscle will abduct the eye, and that's where you get the name. Abducens abducts the eye. The facial nerve or cranial nerve 7 is another nerve that has both sensory and motor fibers. It's one of the most complex cranial nerves. It has special sensory fibers for taste, specifically to the anterior 2/3 of the tongue. Yes, unfortunately, the tongue is innervated by different cranial nerves in different spots, so you do have to know those. The somatic motor fibers are going to innervate the muscles of facial expression, so it allows us to smile or frown, as well as a few neighboring muscles. So the branches of the facial nerve that serve these muscles are shown in the illustration to the right. There are also visceral motor or parasympathetic fibers associated with the facial nerve. These fibers will synapse in peripheral parasympathetic ganglia, and they'll send fibers to initiate secretion from the lacrimal gland, so tears, as well as the submandibular and sublingual glands, which will secrete saliva. Moving on to cranial nerve 8, or the vestibulocochlear nerve, which is entirely sensory, specifically special sensory, involved in hearing and equilibrium. It will enter the internal acoustic meatus of the temporal bone, and that will take it into the inner ear, where it will divide into the cochlear and the vestibular nerves. The glossopharyngeal nerve is cranial nerve 9, and it has both afferent and efferent fibers. There is a lot going on with the glossopharyngeal nerve. There's going to be special sensory taste fibers associated with the posterior portions of the tongue. It's also going to provide the general sensation from posterior tongue. So when I say general sensation, think if you were to touch the back of your tongue, you would be aware of that based on these fibers from glossopharyngeal, whereas that's different than taste. So glossopharyngeal does both. We know that the glossopharyngeal is going to be providing general sensory fibers associated with the pharynx, but it also will for the carotid body and sinus, as well as the middle ear region. There will be preganglionic parasympathetic fibers that originate in the glossopharyngeal nerve that will synapse in the otic ganglion to have those postganglionic fibers destined for the largest salivary gland, which is the parotid gland. And lastly, it does actually have some somatic motor fibers to just one muscle, the stylopharyngeus muscle, which is a muscle of the pharynx. So that you have kind of tongue and pharynx right there in the name. At this point, I hope you are very familiar with the vagus nerve or cranial nerve 10. In fact, we've already described all of these major roles of the vagus throughout the year. But if you need a review, you can find this short summary here. I'm not going to get into those details right now. The accessory nerve or cranial nerve 11 is an entirely somatic motor nerve serving just two muscles, but they're two pretty important muscles. You'll have the sternocleidomastoid in the anterior neck and the trapezius in the superficial back and posterior neck region. And then last but not least, we have the hypoglossal nerve or cranial nerve 12. This is also entirely somatic motor. Think muscles of the tongue, both extrinsic and intrinsic, except for one. So when you hear hypoglossal, I hope you think muscles of the tongue and you will be good to go there. All right, excellent. We made it our way through all 12 cranial nerves. You will have more detail as appropriate as you work through the rest of anatomy and some of the clinical lectures. Thank you so much for your time and attention, and please reach out if you have any questions.